Welcome to PCR London Valves 2024. My name is Nina Wunderlich. I'm an interventional imaging expert from Germany, and I have the honor to be one of the course directors of London Valves PCR. I'm here, and it's my pleasure. I'm here with Victoria Delgado from Spain. So we have 24 sessions on imaging this year at London Valves. So what is the content and what should the message be of these courses?
I think that imaging is very important because for many of the structural interventions that are performed at the cath lab, with fluoroscopy is not enough. And I think that these 24 sessions that I find that there are a small number, we realize the importance of bringing that soft tissue resolution that fluoroscopy doesn't have and bring really the structure in a good view for the interventionalists to perform the procedures. And the new technologies, for example, even the fusion imaging between echocardiography and CT, or CT and fluoroscopy, or fluoroscopy and echocardiography, brings globally, that communication that we need for the interventionalists and the imagers to perform well those interventions. And I think that this is the best scenario to bring that knowledge and to improve that communication and grow together.
So we implemented a couple of new imaging teaching tools. Can you explain that a little bit deeper?
So one of the sessions, or many of the sessions that we have at PCR London Valves this year, are within the Imaging Learning Center. And there are two types: the Imaging Learning Lab, where you have kind of the integration of the different imaging modalities that we use for evaluation of anatomy. So very useful, particularly for interventionalists, but also for imagers to understand the same language. And then we have the Imaging Skills Lab, or Imaging Skills Center, where we have a deep learning in terms of post-processing of echo images. These are perhaps more useful for imagers that are guiding interventions, and that sometimes is difficult to get oriented, to get that communication, but also for interventionalists to come together, both of the imagers and interventionalists, to those sessions helps to understand how we are going to communicate at the cath lab. And one of the most important parts, for example, are the multiplanar reformation planes, which has this very long name, but basically is trying to dissect the anatomy in different planes so that we can guide the intervention more precisely.
I completely agree. I think there's a big need. And this brings me to another connection, Victoria. I mean, you are the course director of PCR Madrid Valves. And what is the difference? So what is the difference between London Valves and Madrid Valves? And what can the people expect if they go to Madrid Valves? What can they learn?
In Madrid Imaging Valves, we have as a main scope of the meeting imaging. And we take the entire path of the patient, the entire journey of the patient, from the diagnosis to accurately evaluate that patient. Is this right time to intervene or not? What do we need more to know in order to refer the patient for intervention? And later on, how do we follow up? So basically, takes the entire journey of the patient, from diagnosis to follow up and through the treatment. And that, I think, is much more like the heart team concept as well. Perhaps the difference with PCR London Valves is that here is perhaps more focused on the intervention, although it has also that starting point of imaging, diagnosing the patient, and also guiding the procedure, but Imaging Valves is broader in that sense.
So to summarize, Victoria, I would say there is a need for education, both on the long-term journey of the patient and on interventions. So this is separated into different conferences, but you can get the entire knowledge if you attend the courses. So we would like to welcome you to the next courses and say goodbye.
Thank you.